Dr. Elizabeth Landsberg is board certified in geriatric, internal, and palliative care medicines, so that's triple certified there. And she provides house calls. Yeah, you heard me right. She still does house calls to the Bay Area with her company called Elder Consult Geriatric Medicine. She founded Elder Consult to provide exceptional medical care at home and through house calls. And it's not just a house. She'll go to wherever you are. For the elderly, particularly those with difficult physical and behavioral challenges. I've known Elizabeth now for about 10 years. I talk to her, to almost every client I know who has a medical issue, if they're a senior, and recommend her. Prior to establishing her practice, Dr. Elizabeth was a hospice medical director. She practiced at the Veterans Hospital in San Francisco. She consulted with Elder Abuse Forensics Task Force in San Francisco, and she was a assistant professor of clinical medicine at UCSF. She graduated from Stanford, and she trained at Harvard University. I give you and please help me welcome Dr. Elizabeth Landsberg.
Well, thank you, Janice, and thank you all for coming out here today. I've got to say, back at you, Janice. I have worked with you for a number of years now, and I worked with Jennifer separately, and it's kind of like a Reese's peanut butter cup, two great flavors, the dynamic duo. They're better together than they were alone, if that can be possible. And I think what I'm saying is almost kind of superfluous. I'm kind of the SWAT of geriatrics. When things are just not going well, I get brought in. But I think you all know that medicine has changed, and that the rules have changed. They have changed so dramatically. It used to be 3 days in the hospital before you could go to skilled nursing. Well, now it's 3 days of what they call admitted to the hospital. I've had people at Stanford in the cardiac care unit on monitors for a hypertensive crisis, and they call that observation. You need someone who knows what the rules are. You need someone who's going to help you out when your loved one or yourself is at the nursing home. You're supposed to be there for rehab, and you've got a bladder infection, and that's why you're not progressing. You need someone who knows what's going on, like the nurse, or someone like Jennifer who knows, what should, and everyone does know that you were an ombudsman, so yeah, she's worn many hats. She's, a talented therapist, and she's also been very helpful in my challenging cases. I mean, when someone does go, and actually I'd expand your practice already. I would say, the emergencies are important, but I think just having your advocate go to the doctor's visits is huge too, in between, because then they have the scope of what's going on. I know that I work a lot with folks with dementia, not always, sometimes just complicated folks, but I've had the experience of our patients being sent to the emergency room because they're not eating, and they come back with a diagnosis of dementia. Well, they went from a dementia unit, so we knew that. But it can be subtle. Someone can have a heart attack and then just not feel so good or just be kind of sweaty, and it depends a lot on the doctor at the emergency room. There's some fabulous ones. I got to say, if you're ever at Good Sam, I really like Dr. Gunatalaka. And then there's other ones who are just like, okay, vital signs okay, everything looks all right, but they haven't done the thorough workup, and you need someone who's saying, yeah, but she was saying she hasn't been eating for the last couple days, and you're saying she's fine to go home. Why isn't she eating? I mean, that's what's really important. So I would say, I want to sign up for this too. You're not in my county yet.
You can go outside of the county by special arrangement. Talk if you want to.
Right. I will say, I've had, if any of my folks, I'm on call 24/7 too, and if any of my folks go to the hospital, then I'll call the ER doc, and if they get admitted, I'll talk to the ER physician, and I'll go in a day or two. But there's been times when even that, I've talked to one doctor, and then the next doctor changed the meds on me, and you come in and your patient is schnockered. And you need someone who's there to kind of know that, something has changed. You also need to know if it's an appropriate discharge. I have had the unfortunate experience, in one county where someone had to have a hip replacement after a fracture, they went to skilled nursing. In the other county, similar sort of hospital, and this isn't Santa Clara, so I'm not throwing any stones, they would not let this little gentleman who was very frail with dementia, who fractured his hip, go to skilled nursing. They said he didn't qualify, which was not true. So a week later, he's in assisted living dementia care, and his wound opens up. It's called dehisced. So we sent him back going, okay, now they'll keep him. They sent him back to assisted living saying, well, now we'll just do wet to dry dressings, which they can't do in assisted living. And then he had a fever. A week after that, went septic, and they had to pull the hardware, and then he went to skilled nursing. So, there's some really terrific doctors who are going to make sure that things happen. And then there's other doctors who just check the box and move you on because they have 30 other people to see. So I definitely think that, having someone who can be there with you, who can help with your history. What I've included on your table is, for those who are unfortunate enough not to be members yet, it's to put on the refrigerator. You can put your history, you can put your medications, and then it's also good, talking to Janice, everyone should have their pulse done correctly. I have mine done, and I've figured out who's going to be taking care of my kids and everything if something happens to me. So everyone, no matter your age in the room, needs to take care of that too. And that's what Janice has always been great for the clients. Or my other area of interest is taking care of folks with early dementia and cognitive changes and the concerns of financial elder abuse, and these guys have been terrific for the team there as well. But frankly, I don't have much more to add. I mean, this is a dynamic duo, a dynamic team, and I look forward to see what's coming next. Thanks so much.